Good evening, everyone. This is Robin Graham, and I'd like to introduce my LEM model on diabetes. As you can see here, we start with the course going into online asynchronous, and the student or learner will first watch a video presentation and then an ebook reading on D2L. Then they will move on to a quiz over the video and the reading on diabetes, and all done on D2L. Something that I added that I learned from this class was the graphics assignment that we did, where we read an article and then had to, with pictures or graphics, explain what we read. And so I actually put this in my class, and my students loved it. They were able to put a picture with the diabetic questions we ask a patient in the clinic to make sure they're well-controlled diabetics, and just really had great success with that assignment. And so that is the graphics. Of course, there's instructor feedback. I gave instructor feedback on the discussion board in D2L. And then once that was completed, then they move on into the classroom. And this is where I begin my lecture, and I use PowerPoint presentation. We have class discussion during the diabetes lecture, and I give feedback with this discussion. Once this part is done, we move on into quizzing over diabetes, and I use Kahoot. I've had really good luck with Kahoot. It's kind of competitive in nature, kind of like our students, well, my students, and they really enjoy it. The person that answers the question the quickest and is correct ends up at the top of the leaderboard. They get to kind of pick a name for themselves, and so it's kind of fun, but at the same time, they really enjoy that and they get a lot out of it. So once they've done the quiz on Kahoot, we move into the case study exam, and this is over diabetes, where they are actually problem-solving diabetic patients, issues with diabetic patients, and this is where we move up the ladder in Bloom's taxonomy to get that higher level learning with the case study. And so it's what I would consider an exam in itself. Our students are tested on their national board with, half of the day is case study based type questioning. So moving from the case study exam, we move down into the final exam, where you can see all my objectives or outcomes are listed here, where they describe, they list, they identify, that type of thing for the final exam. Once that is done, they move on into the experiential, where they actually, on a patient, kind of keeping in mind that graphics assignment that I had them do, where they have to ask a patient those 6 questions, have to remember that, hopefully with that visual that they have in their mind that they did on that actual assignment. They are in the clinical setting with a diabetic patient, the instructors with a rubric, and we're listening to make sure that they're asking the patient those questions to make sure they're well-controlled diabetes before they seek treatment in our clinic. And we look at the answers that the patients have given, and making sure that the student is kind of corresponding the answers with the questions to make sure they are well-controlled and it's okay for treatment in our dental clinic. And from there, they exit the course. Thank you very much.